Hey guys, my name is Riyad Ali and I'm a registered physiotherapist at Progressive Health Services, and today we're going to talk about carpal tunnel syndrome. So there are many causes for carpal tunnel syndrome actually, but the main ones are usually because of your workplace, of how you are set up at your workplace and the type of work that you do, which involves a lot of bending of your wrist, and your wrist in a very specific position where it's bent a lot. Because as you see, there is a lot of things that pass through in your wrist here. Okay, so there is the median nerve, which is the main nerve that runs through the hand, through that carpal tunnel area. Within that carpal tunnel, there are different tendons, there are different sorts of structures that passes through there, as well as this median nerve that I'm speaking about. And this median nerve supplies the feelings towards your fingers, mainly your index finger, your middle finger, and your thumb, right? So when people are usually complaining about this pain or this sort of tingling, sort of burning that you feel in the hand, it's usually coming from that nerve, and it's the pressing of that nerve, the compression of that nerve. And you're thinking, what makes this nerve become compressed? Why is it compressed, right? And that's because, again, because of the type of work that you do where you constantly bend the wrist, right? So any amount of work, any type of work that has this wrist in a bending motion like this, it squeezes against that carpal tunnel there, and then squeezes against the nerve, and therefore blocking the signals towards the fingers. And when you block those signals to the fingers, you tend to lose the feeling. And when it tries to reconnect back to get the feelings back in the nerve, it sends out these weird signals such as the burning and tingling that you feel. At Progressive Health Services, we provide a lot of different treatments available for you for this condition. Firstly, there is physiotherapy management. We provide physiotherapy services where I do an entire assessment of the person who's affected by this carpal tunnel syndrome, and I see how their whole life is conducted. Basically an everyday function of what they do. So they will let me know what they do from as soon as they get up till the end of the day. And based on that, I will let them know what needs to be corrected or what needs to be zoomed in on so that it can be adjusted where you get a little relief from this wrist pain. And based on that assessment, I will give you lots of different stretches, different exercises, and different ergonomic positions that needs to be put in place so that you can get better relief for your condition. The next thing we offer to here as well is the corticosteroids. The corticosteroids are effective in the fact that they provide decrease in inflammation and swelling to the area. So that goes hand in hand also with the physiotherapy. One may not be exclusive of the other. I hope to see you soon at Progressive Health Services, where we provide help for your condition, for this carpal tunnel syndrome, where we can provide some relief for your pain that you are getting.
If you're experiencing hand or wrist pain, numbness, tingling, or weakness caused by carpal tunnel syndrome, physiotherapy can help reduce pressure on the nerve, relieve pain, and restore function. Call or WhatsApp us today at 747-5297 or 3083370 to schedule an assessment and begin your carpal tunnel physiotherapy treatment.